Coronavirus disease 2019, COVID-19, rapidly recognized as a pandemic, triggered a global public health emergency with a death toll of approximately 15 million between 2020 and 2021. The predominant clinical manifestations exhibited by COVID-19 patients are related to respiratory and gastrointestinal tract disorders. The virus that causes the disease, SARS-CoV-2, is an enveloped, single-stranded RNA virus that transmits via aerosols, respiratory droplets suspended in the air, when prolonged face-to-face contact is maintained, or when a person is exposed to contaminated surfaces. The entry of SARS-CoV-2 into host cells triggers an antiviral inflammatory response, consisting of both the innate and adaptive immune responses. In severe cases, it can induce sepsis, a condition marked by life-threatening organ dysfunction due to a dysregulated immune response, cytokine storm. Although vaccination remains the forefront prevention and treatment strategy for COVID-19, the virus continues to evolve and mutate rapidly. Therefore, managing SARS-CoV-2 infection requires exploring effective multidimensional therapeutic approaches, especially in underdeveloped countries where vaccine regimens are difficult to procure and implement. In the 3 years since the first outbreak of COVID-19 in 2019, the SARS-CoV-2 virus has continued to be prevalent in our community. It is believed that the virus will remain present and be transmitted at a predictable rate, turning endemic. A major challenge that leads to this is the constant yet rapid mutation of the virus, which has rendered vaccination and current treatments less effective. Due to their numerous therapeutic implications for intestinal health and other areas related to the gut organ axis, probiotics can dynamically regulate the host's health. They are generally regarded as safe, GRAS, and have also been shown to produce many bioactive compounds with antiviral activities. In our previous study, we reported the potential of bacteriosan from L. plantarum PROBIO88, plantaricin E and F, in the inhibition of SARS-CoV-2 replication and in immune regulation, using an in vitro and in silico approach. In this study, we intend to further evaluate the effects of other probiotic strains, which do not produce plantaricins E and F, on the pathogenesis of SARS-CoV-2. The strain Lactobacillus sakei probio65, which is isolated from kimchi, a type of fermented cabbage from Korea, has previously been reported to exert broad antimicrobial properties, as well as displaying antiviral activity against avian influenza virus, H9N2. In our study, the Lactobacillus sakei probio65 extract, P65CFS, was tested for its safety and efficacy in inhibiting SARS-CoV-2 replication. Viral load quantification by RT-PCR showed that the P65CFS inhibited SARS-CoV-2 replication in human embryonic kidney, HEK, 293 cells in a dose-dependent manner, with 150 mg per milliliter being the most effective concentration. No cytotoxicity was inflicted on the HEK 293 cells, human corneal epithelial, HCE, cells, or human cervical, HeLa, cells, as confirmed by the 3, 4, 5-DIMETHYLTHIAZOL2YL, -2, 5-DIPHENYL2H tetrazolium bromide, MTT, assay. The P65CFS, 150 mg per milliliter, also reduced 83.40% of reactive oxidizing species, ROS, and extracellular signal-regulated kinases, ERK, phosphorylation in virus-infected cells, both of which function as important biomarkers for the pathogenesis of SARS-CoV-2. Furthermore, inflammatory markers, including interferon alpha, IFN-alpha, IFN-SS, and interleukin-6, IL-6, were all downregulated by P65CFS in virus-infected cells as compared to the untreated control, P less than 0.05. It was conclusively found that L. sakei probio65 showed notable therapeutic efficacy in vitro by controlling not only viral multiplication but also pathogenicity. For details, refer to our research paper. The inhibition of SARS-CoV-2 and the modulation of inflammatory responses by the extract of Lactobacillus sakei probio65. Vaccines 2022, 10, 12, 2106. Thanks for watching.